Hypertension lifestyle modification and treatment. Hypertension is a chronic condition managed through lifestyle modifications and pharmacological treatment, with a focus on reducing blood pressure and preventing complications. Overview. Hypertension, or high blood pressure, is a major risk factor for cardiovascular disease and stroke. It is a non-contagious condition characterized by persistently elevated arterial blood pressure. Lifestyle modifications remain the first-line treatment for most patients, with pharmacological therapy reserved for those who do not achieve target blood pressure with lifestyle changes alone. Pathophysiology/mechanism of action. Hypertension is primarily due to increased systemic vascular resistance and/or increased cardiac output. The renin-angiotensin-aldosterone system, RAS, plays a central role in regulating blood pressure. Activation of RAS leads to vasoconstriction, sodium and water retention, and increased blood volume, all of which contribute to elevated blood pressure. Lifestyle modifications aim to reduce these physiological stressors, including reducing sodium intake, increasing physical activity, and managing weight. Clinical features/indications. Hypertension is typically asymptomatic, but in some cases, patients may experience headaches, dizziness, or shortness of breath. It is often classified as either essential, primary, or secondary, with secondary hypertension due to underlying conditions such as kidney disease, hyperthyroidism, or certain medications. The American College of Cardiology and the American Heart Association classify hypertension into stages based on blood pressure readings, with target goals of 130/80 mmHg for most patients. Diagnosis/monitoring. Diagnosis of hypertension involves measuring blood pressure in a seated position, with the use of a validated sphygmomanometer or automated blood pressure monitor. Repeat measurements are recommended to confirm the diagnosis, especially in patients with ambiguous readings. Blood pressure should be monitored regularly, with a target of 130/80 mmHg for most patients. Additional tests may be required to identify underlying causes, such as kidney function tests, lipid profiles, and thyroid function tests. Treatment/management. Lifestyle modifications are the cornerstone of hypertension management. Key recommendations include: pharmacological treatment is indicated for patients who do not achieve target blood pressure with lifestyle changes alone, or for those with specific comorbidities. Common first-line medications include thiazide diuretics, ACE inhibitors, and ARBs. The choice of medication depends on individual factors, including age, race, comorbidities, and potential drug interactions. Blood pressure should be monitored regularly, with a target of 130/80 mmHg, and adjusted as needed. Key points: reducing sodium intake to less than 1,500 mg per day. Increasing physical activity to at least 150 minutes per week. Maintaining a healthy weight. Limiting alcohol consumption. Key clinical points. Key points: lifestyle modifications are essential for managing hypertension and reducing the risk of cardiovascular events. Blood pressure targets should be individualized based on age, comorbidities, and overall health status. Regular monitoring is critical to assess treatment effectiveness and adjust therapy as necessary. Patients with secondary hypertension require targeted evaluation and management of underlying causes. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.